So today I will be discussing your another important topic. This is your scapula bone. Okay. So first, the location means where it is located. First listen properly. Okay. After that you can write it down. First listen. So this is your scapula bone. Okay. So this scapula bone is located mainly your, this portion is called your which region? This is thorax, means the thoracic cage. This is. So this is your anterior surface or anterior view, and this is your posterior view. So posterior to your thoracic cage, this is your scapula bone. Okay, so this is, see, triangular shape flat bone, also called the shoulder blade, because this is located to your shoulder region. Okay, and the main location is posterior lateral aspect of your thorax. Okay, so posterior lateral aspect of the thorax, your scapula bone is located in between your second to seventh rib. In between the second and seventh rib, your scapula bone is located. Okay, so first is the location, and next one is your anatomical position. Before knowing the anatomical position, you have to know some parts regarding your scapula bone. Okay, so always remember the scapula bone having mainly 3-4 parts. Okay, first is your body of the scapula, another 3 is the spine, the processes of the scapula. Okay, there are 3 processes. One is your called your spine like projection, this is called your spinous process. Okay, and this spinous process is continuation to your another process, this is called your acromion process. Acromion process is important because of here your which bone is at articulate clavicle, and from acromioclavicular joint. Okay, so first one is your spinous process, another one is your acromion process, another one is your this process, this is called your coracoid process. So 3 process, except these 3 process, the whole this part is called your body of the scapula. Okay, so in the body of the scapula there are border, surface and angles are present. So do you know what is this border and surfaces? Suppose this is your anatomical position. Here, see, this is your border mainly. Okay, so this is which border? Lateral side, means lateral border, and this is, and this part called your surface, anterior surface or dorsal ventral surface, another one is posterior surface or dorsal surface. Like this, here also there are now 3 borders, 1, 2 and upper border. Okay, so 3 border in the scapula bone, there are 3 border, 3 angle and 2 surface. Okay, so in the body there are 3 borders, 3 angle and 2 surface. First the surface, see, this is the anterior surface mainly. Okay, this is the anterior surface, another one is posterior surface. Always remember, in the posterior surface, here your spine of the scapula is present. Okay, so in the spine of the scapula, the location is always in the posterior surface. Okay, posterior surface also called the dorsal surface. Okay, so before knowing the anatomical position, first one is your process, the spinous process. Always remember the spinous process is present posteriorly. Okay, another one is very much important point. Here you can see one cavity is present. Okay, cavity or fossa. Okay, this is called your glenoid cavity. Here your which bone is articulate? Head of the humerus bone and from shoulder joint. Okay, shoulder joint comes as a long question, 10-mark question. Okay, so this is your glenoid cavity or glenoid fossa. Always remember this glenoid cavity is always located laterally. Glenoid cavity is always located laterally. So first one is your spinous process. Spinous process is always present posteriorly. Another one is your glenoid cavity. Glenoid cavity is present laterally. So this is the anatomical position, and this is my right sided scapula bone. Okay, because first criteria is the glenoid cavity. The glenoid cavity is always located laterally. Another one is the spinous process. Spinous process is present posteriorly. Another one is this is called your coracoid process. Coracoid process is always located anteriorly or forward. Okay, so these 3 points you have to remember. Okay, so if I hold like this is right or wrong? So this is not my left scapula, okay, because here spinous process is anteriorly present. By in the rules, the spinous process is always posteriorly present. So this is the right sided scapula bone, okay. Next, the parts along with the muscle attachment, okay. See, first the scapula bone, also called the shoulder blade. This is large flattened triangular shaped bone, is mainly present your posterior lateral aspect of the thorax in between the second to seventh rib. So this is the location. First you have to know the location where it is located. Next, the parts body and three process. Name of these three process, first one is your spine of the scapula, another one is your acromion process, another one is your coracoid process. In the body, see, this is the structures, okay. So always remember, this is called your which cavity? Yes, glenoid cavity is located lateral side or medial side? Lateral side. So here, so this border is called your which border then? Lateral border, because glenoid cavity is present laterally. So this border is called your lateral border. Always remember, this lateral border is quite thick as compared to your medial border, okay. So this is called your medial border. Medial border, lateral border, another one is your upper border or superior border, okay. So there are three border along with three angles. See, there are one angle present. So this is called your which angle then? Inferior angle. Another one is your here superior angle. Another one is your lateral angle. Here this lateral angle are covered by this cavity, okay. This is called your glenoid cavity. So there are three angle, three border and two surface. This is called your which surface? Anterior surface or costal surface. Why it is called costal surface? Because here your costal cartilage, mainly this rib cage are present, okay. That's why this is called your costal surface or ventral surface or anterior surface, okay. Another one is your, this is called your posterior surface, because here your spine of the scapula is present posteriorly, okay. See, so this is your glenoid cavity, then this is your lateral border, this is your medial border, and this is your upper border or superior border, okay. And there are, this process name is coracoid process, and this is your which process then? Acromion process. Here your clavicle bone is articulates and from your acromioclavicular joint, okay. So this process called your spinous process. So this is this view, okay. This is mainly the anterior view, okay. And this surface called your which surface? Anterior surface or costal surface or ventral surface. Next, this is the posterior view mainly. Here you can see, this is your spine of the scapula, okay. This is your lateral border, this is the medial border, this is your inferior angle, this is your superior angle, and here your lateral angle is which is covered by your glenoid cavity, okay. Next, in the body, two surface, three border and three angles are present. Next, the processes, spinous process, continuation to your acromion process, another one is your coracoid process. Next, the anatomical position. Anatomical position, there are three things mainly. First one is your glenoid cavity, okay. Always remember, in the glenoid cavity, means the glenoid cavity is located laterally. So, can anyone tell me, so this is right sided bone or left sided bone? You tell me. First, see the three criteria. First one is your glenoid cavity. Glenoid cavity is present laterally. And the spine of the scapula present? Spine of the scapula posteriorly, okay. See, tell me. So hold in left hand, okay. So the three criteria is fulfilled here, because see, so this is basically your left sided scapula, because if I hold like this, the criteria is fulfilled or not, because the spine of the scapula here anteriorly present. So the spine of the scapula should be posteriorly and the glenoid cavity is laterally and the coracoid process is anteriorly. Left sided scapula bone. So this is your right sided, because here the criteria, three criteria is fulfilled. So this 3 point is very much important. First one is your glenoid cavity, another one is your spine of the scapula, another is the coracoid process is forward or anteriorly present. Okay. Next, the parts along with your muscle attachment. Okay. First, one by one. First is surface. Okay. First, let us discuss the surface. Always remember, in the surface, here you can see this is not convex structure, like concave like structure. See, means here one fossa is present. This is called your subscapular fossa. The subscapular fossa is present mainly your which surface? Anterior surface. So in the anterior surface, subscapular fossa is present. Here your subscapularis muscles is attached. Okay, one big muscle attached here. This is called your subscapularis muscle. Okay, so first in the anterior surface, subscapularis fossa is present. So here your subscapularis muscles is attached. Okay, and this is mainly which border? This is which border? Lateral border कैसे होगा? Because here glenoid cavity present, so this is your medial border. Always remember, in the medial border, anterior surface, medial border, anterior surface. Here your another important muscles is attached. This is called your serratus anterior muscle. Okay. Clinically, this muscle is very much important. You have to know. So in the anterior surface, there are two muscle attachment. Okay. First one is your, this is subscapularis fossa, means the subscapularis muscle. Another one which is attached to your which border? Medial border, anterior surface. This is called your serratus anterior muscle. Clear? So this is mainly the anterior surface. Now the posterior surface. In the posterior surface, see, this is your spine of the scapula. Okay, by the spine of the scapula, see, your posterior surface is divided into two parts, upper 1/3 and lower 2/3. Upper small part, lower big part. Okay, so this is your spine of the scapula. So upper part of the spine, it is called your which fossa then? Upper part of the spine means spine के ऊपर, superior, supraspinatus fossa. Okay, and here your infraspinous fossa. Okay, supraspinous, infraspinous. So by the presence of your spine of the scapula, upper part is called your superior. Question में आंसर है supraspinatus. Okay, spine के ऊपर supraspinatus fossa and नीचे infraspinatus. So here your which muscle attached then? Supraspinatus and here infraspinatus. But in the posterior part, there are so many muscles are attached. Okay, just easily you have to remember, this is called your then which border? This part, lateral border, because your glenoid cavity are present laterally. Okay, so this is basically which surface? Posterior surface. So posterior surface, there are three muscles are attached. Posterior surface, lateral border, there are three muscles attachment. Anterior surface to clear, there are two muscles. Subscapularis, another one is serratus anterior. But in the posterior part, by the presence of the spine of the scapula, there are two muscles, supraspinatus, infraspinatus. But here, another muscles are attached. First, focus the lateral border. Lateral border, posterior surface. First one is your teres minor muscle. Okay, upper 2/3, teres minor. Upper 2/3, teres minor. Then lower 1/3, teres major. Along with the little bit of your latissimus dorsi muscle. Okay, here just you remember all those name. Okay, the muscle description is covered in your dissection class. So lateral border, posterior surface, there are three muscles attached. First one is your upper 2/3 is teres minor, then teres major, then latissimus dorsi. Similarly, in the, this is called your which border? Medial border. Medial border, posterior surface, there are another two muscles are attached. One is your similarly minor, but here rhomboidus minor. Okay, here teres minor, upper 2/3, but here rhomboidus minor, upper 1/3, and lower 2/3 is rhomboidus major. Suppose this is your spine of the scapula. So which one is you called root of the spine then? कहाँ से start हो रहा है तुम्हारा spine? See, This is called your root of the spine. Okay. Okay. So here your another muscles is attached. This is called your levator scapulae muscle. So here mainly in the medial border, three muscles is attached. Okay. In the root of the spine, levator scapulae. Then in the medial border, posterior surface, there are another two muscles attached. First one is your rhomboideus minor. Another one is your rhomboideus major. Okay. So that's all about the muscle attachment in the body. Okay. Clear? Understood? Okay. First recap all those things. First muscle attachment, anterior surface. Anterior surface में क्या है? Subscapularis fossa. So here subscapularis muscle, and along with in the medial end means medial border, anterior surface में serratus anterior. Now the posterior surface. In the posterior surface, by the presence of the spine, upper part of the spine is called supraspinatus fossa या supraspinatus muscle, and lower part is called your infraspinatus muscle. Okay. The next another muscles is attached. This is called your mainly which lateral border, posterior surface. There are another three muscles attached: upper, two-third, teres minor, then teres major, then latissimus dorsi. Similarly, this is called your root of the spine. Here your levator scapulae muscle, then medial border, rhomboideus minor, rhomboideus major. That's all about the muscle attachment. Okay. Now the process. See, this is mainly the anterior view. In the anterior view, there are two muscles attached: subscapularis, another one is serratus anterior, and in the posterior surface, supraspinatus, infraspinatus. In the lateral border, posterior surface, teres minor, teres major, latissimus dorsi. And this is the root of the spine. Here levator scapulae, rhomboideus minor and major. Okay. Now see, this is the surface. It is mainly concave, and this is called your subscapular fossa. Here subscapularis muscles is attached along with the serratus anterior muscle. Next, one more thing. See, so this is mainly the dorsal surface. By the presence of the spine, supraspinatus, infraspinatus. But here you can see there are one notch is present. Okay, in between your spine of the scapula and the glenoid cavity. In between one notch is present. Okay, this is called your spinoglenoid notch. Spinoglenoid notch. By this notch, your suprascapular nerve and artery passes through this notch. Okay, and this is mainly connection in between your suprascapular and infrascapular muscle. Supra means supraspinatus, infraspinatus muscle. Okay, so here this notch is very much important because here your subscapularis muscle, suprascapularis muscle and nerve and vessels are passed through this. Okay, so this notch is name is spinoglenoid notch. Okay. Next one is muscle attachment: supraspinatus, infraspinatus, teres minor, major, latissimus dorsi. Okay. Next, the superior border. See, this is your superior border. Okay, so superior border is shortest border as compared to this another two border, and this is present in between your lateral. No, this is called your medial border and lateral border. Okay. Next is your another things is very much important. This is called your another notch. Okay, this is called your suprascapular notch. Scapula के ऊपर superior suprascapular notch. Okay, see what is the meaning this line. The suprascapular notch is converted to the suprascapular foramen by the superior transverse ligament. Suppose there one ligament is present, this is called your transverse ligament, superior transverse ligament. By the presence of this ligament, see one foramen is from na. Okay, from this foramen, upper part of this ligament, your one mnemonic is there. Okay, artery is above. Okay, and the nerve is below. Okay, by this ligament, your one foramen is present. Okay, so here upper part of this ligament, your artery is going, and the below your nerve is passed through this. Okay, so always remember there are two notches are present. This is called your spine and glenoid cavity, spinoglenoid notch, and this is your suprascapular notch. Here your mainly the suprascapular artery and nerve passes through these two nodes. Okay. Next one is your lateral border. So lateral border. So this is your lateral border. Okay, because the glenoid cavity is present laterally. Here your lateral angle also present, but by the presence of your glenoid cavity, you can see this lateral angle. Okay. So here always remember there are two tubercles present here. Okay, two tubercles are present here. Okay. See, this is your glenoid cavity. Upper part and lower part. There are two tubercles present because in these two tubercle, the two important muscles of the arm are attached here. Okay. So always remember this is called your supraglenoid tubercle because glenoid cavity के ऊपर में है superior supraglenoid tubercle and this is called your infraglenoid tubercle. Okay. So in this always remember in the supraglenoid tubercle the biceps muscle are attached. Long head of the biceps muscle are attached in the supraglenoid tubercle. But in case of the infraglenoid tubercle, the long head of the triceps muscles are attached here. Okay. Biceps and triceps. Next, the processes. Okay. First, see properly. This is called your spine of the scapula. Okay. In the spine of the scapula, mainly two muscles are attached. Okay. In the spine of the scapula, this is called your upper lip. This is called your lower lip. In the upper lip, this muscle, trapezius muscles is attached. This muscle is called your trapezius muscle, helping in shrugging of the shoulder. Okay. Another one is the deltoid muscle. This muscle here your intermuscular injection is given here. The deltoid muscle. Okay. So trapezius muscle and deltoid muscle. Trapezius muscle is present upper lip and the deltoid muscle is present in the lower lip. Always remember the deltoid muscle is covered your acromion process also. Okay. So here you can see one thing. Okay, see the deltoid muscle is covered your acromion process also. So always remember in the spinous process two muscles attached, but in the acromion process only your deltoid muscle is present. Okay. See, this is your trapezius muscle. Okay, mainly present your upper lip of the spine of the scapula, but your deltoid muscle is present the spine of the scapula lower lip along with your acromion process also. Okay. Next one is your very much important coracoid process. Always remember in the coracoid process tip and surfaces are present, upper surface, lower surface and tip. In the tip of the coracoid process, okay, there are two muscles attached. One is your coracobrachialis, another one is your short head of the biceps muscle. These all two muscles are your upper arm muscle. Okay, front of the arm muscle. Always remember these things comes in the OSPI Viva. Okay, this process, coracoid process, the tip of the coracoid process, muscle attachment. Okay, important. So there are two muscles attached. One is your coracobrachialis, another one is your short head of the biceps muscle. But in the surface of the coracoid process, only one muscle is attached. This is called your pectoralis minor muscle. Okay. So that's all about the muscle attachment. Now recap all the muscles attachment. First, this is called your anterior surface. Okay, anterior surface mein two muscles are attached. First is subscapularis muscle, another one is serratus anterior. Next, posterior surface. In the posterior surface, there are so many muscle attachment. First one is your by the presence of the spinous process, supraspinatus, infraspinatus muscle, and in the lateral border, three muscle. Teres minor, teres major, latissimus dorsi, and in the root of the root of the spinous process here your levator scapulae, then rhomboides minor, rhomboides major. Now there are two foramen, means foramen matlab notch. There are two notches are present. This is called your spinoglenoid notch, suprascapular notch. Okay. Here the suprascapular nerve and artery passes through this. Okay. And one more thing, this is your spinous process. Upper lip of the spinous process, your trapezius muscles is attached, and the lower lip deltoid, and deltoid muscles is attached along with your acromion process also. Okay. Here your tip of the coracoid process, there are two muscles attachment. One is your coracobrachialis, another one short head of the biceps. Another is the pectoralis minor muscle attached mainly the superior surface here. Okay, superior surface. Another thing is your glenoid cavity. Always remember, in the margin of the glenoid cavity, this is called your glenoid labrum. This is basically the fibrocartilaginous, because here your this head of the humerus is attached here and from your shoulder joint. Shoulder joint is very much important in the theoretical part of view. Okay, 10-mark question, long question. In the glenoid cavity, there are two tubercles are present: supraglenoid tubercle, infraglenoid tubercle. Okay, in the supraglenoid tubercle, the long end of the biceps muscle are attached. In the infraglenoid tubercle, long head of the triceps muscles are attached here. Okay, so that's all about this. Now one more thing is the ossification. Okay, what is the meaning of ossification? Formation of bone. Okay, so simply you remember there are one primary center and 7 secondary center. Primary center present the body, and the secondary center, 2 center are present, coracoid process, 2 are acromion, and one of each are present the medial border, inferior angle, and the glenoid cavity. See, 2 is present in coracoid process, another 2 acromion process. This is mainly the body part, and here medial border, inferior angle, and the glenoid cavity. Okay. Now the clinical anatomy. This is the last part. First one is your scaphoid scapula. This is basically the congenital anomaly which is happen in intrauterine life. Okay. So here in the scaphoid scapula, normally always remember the medial border. See, this is the medial border. This is concave. Convex. Okay. But here in the scaphoid scapula, the medial border is concave in shape. Okay. This is the congenital anomaly. Another one is your the Sprengel deformity of the scapula. Normally the scapula is developed from this part and धीरे धीरे ये नीचे की तरफ तुम्हारा डाउनवर्ड्स मूवमेंट की तरह ये डेवलपमेंट होता है. बट इन केस ऑफ द स्प्रेंजल डिफॉर्मिटी दिस थिंग्स आर नॉट डन. सो फेल्योर ऑफ डिसेंट लीड्स टू द स्प्रेंजल डिफॉर्मिटी of the scapula. The scapula is look like this here, upper part. Okay, normally the scapula is present here, but in the Sprengel deformity the scapula is upper part. Okay, next one very much important, winging of the scapula. Winging of the scapula comes as a short note. Okay, so serratus anterior muscle, where it is located here, anterior surface, medial border. Okay, so here you mainly the serratus anterior muscle is paralyzed. Okay, by the paralysis of your long thoracic nerve, because the serratus anterior muscle is supplied by the long thoracic nerve. Okay, long thoracic nerve mainly located. You completed your brachial plexus class. Here your long thoracic nerve is present. Okay, so long here per just remember the long thoracic nerve is supplied by your this muscle. Okay, this serratus anterior muscle. So this muscle is paralyzed by paralyzing this nerve. Okay, so कैसे paralyze होता है? Common causes of this nerve injury are any kind of trauma, okay, any kind of accident or fall from height or repeated overhead activity. Another important thing is mastectomy surgery. Do you know the mastectomy surgery? This is mainly the breast surgery. Okay, so the surgeon get, if by mistakenly cut this long thoracic nerve, this muscle get paralyzed. So here this condition is happened. If you examine the patient, you can tell to press this wall. Here you can see the medial border is like this, prominent. Okay, so this situation causes your winging of the scapula. So winging of the scapula happen to paralysis of your long thoracic nerve, which is supplied to your which muscle? Serratus anterior muscle. So serratus anterior muscle paralyzed, long thoracic nerve paralyzed. So this paralysis is done by the common causes are, first is the fall from the height, accident, or in surgery means the breast surgeries. Okay, so this condition call your winging of the scapula. So that's all about the today's class.